Hi there, my name is Sarah Blonigan and I'm the new Juniper Network Director. Today we're going to talk about the basic HIPAA training for you all, the Juniper Network members, and what to do with personal health information when you have access to it. And basically what are the best practices for handling that, what is called PHI. So what is HIPAA? We know that it's an acronym, but what does it really stand for? Health Insurance Portability and Accountability Act. And that was initially started in 1996 to protect people from losing their health insurance and from going from job to job, and those with pre-existing health conditions. However, it has taken shape over the years, and what we're concentrating on today are two aspects of the law. One is the privacy of health information, which is the privacy rule, and one is security of their health information, which is the security rule. And most recently, it has included some standards to follow those security rules for business associates of those affiliates under a business associate agreement with a covered entity. So I mentioned covered entity, and that's something that Juniper is. Juniper is a covered entity and essentially a clearinghouse of information. And we are a network of community organizations across Minnesota that are delivering the evidence-based programs to help people manage their chronic health conditions. And in that process, it's a healthcare organization. We gather health information and other types of information. And because we're a covered entity as a clearinghouse, we do need to follow the HIPAA rules. So here's an image discussing Juniper, or Innovations for Aging, as being the intermediary or the kind of entity in between health plans and the Juniper network, which is you all. And the reason why we're discussing the intricacies of the HIPAA law today is because of the health plans and the private information that's coming from the health plans, coming from the Juniper network, and crossing in between the Innovations for Aging, or Juniper, database system. So this is the first portion of the HIPAA rule, privacy. And privacy is really an important aspect because we all, as individuals with our private information, would like to have that information stay private. So the private information can be stored in many forms, especially through the Juniper network. It can be on paper, it can be electronic, or it can be during our conversations with individuals. And we have the responsibility as Juniper, the covered entity, and its affiliates, which are you all, to follow these standards. So we need to be careful in how we use the personal identifiable information, or PHI, or protected health information. So this does include various forms, and really, because we're a covered entity and a healthcare organization, it does include all of the type of information that is listed on this slide here. So health information, including health status, the condition of an individual, the type of healthcare that individual is receiving, but it does also include individual identifiable health information, or IIHI, that is transmitted through the Juniper program. And that can include just somebody's name, their first initial and their last name. It can include their date of birth, their social security number, their health care provider number, their health care provider name, or the system that they're receiving their health care under. So it really is a broad spectrum. And it can be transmitted, as stated before, through any type of medium: paper, electronic, verbal. So if you go home to your family and you mention an individual's name participating in a class, that is a verbal communication, and that's PHI that can be shared outside of the scope of what we're allowed to share that information for our purposes of our work. So that discusses, I kind of did an overview of what PHI is, but how you would likely encounter PHI as well in the roles that you're playing while offering these services to the participants. So some specific examples include when a participant does register through our online system or if it's in class. So that includes full names, phone numbers, email addresses, social security numbers, health insurance numbers, but it also does include information on the survey data that is collected. So any forms that are collected with the pre and post survey data. And it does also include the class list or the attendance form. So again, when we are a covered entity or affiliates of the covered entity, there's that business agreement or the business associate agreement, and we can only use the PHI for certain purposes unless we do have written authorization. However, we don't need written authorization if we do use information for treatment, payment, or healthcare operations, which is termed as TPO. And the basic principle is that we do not want to use the information in any reason outside of the scope of our work. So we want to follow the minimum necessary rule, which is we want to limit the use of sharing PHI in the amount necessary to accomplish the purpose of our goal, or of sharing the information with other cover entities that we might have agreements with, or the use through the online database, but just the minimum amount necessary to accomplish those purposes. So in addition to requiring to follow these laws, another portion of the privacy rule is that we're required to provide participants with a notice of our privacy practices. And this is something new, as maybe you heard in Mark's earlier video, something new for 2019. And we do need to provide all of the participants with our privacy practices form. We need to, in good faith, make an effort in obtaining the patient's receipt of that notice. So a written notification that they received that notice. And the notice, what it does is it informs the individual how Juniper and its affiliates or business associates use their PHI and informs them of their rights to access their PHI. So in addition to the privacy rules, there's the security rule, and this is basically keeping all of that private information secure and not accessible to entities that should not be accessing that information. And we have the responsibility to protect that information. So not only keep it private, but to protect it. So when you are safeguarding that information for the PHI, we want to think about where you are and who might overhear that information that you're sharing, or who might see it, or who might access it. So really just keep in mind, don't leave the paperwork that you've gathered in an open space and leave that space with all of the information there sitting out. Or in the backseat of your car, make sure you keep that information out of easily viewable, kind of just cover it up in the backseat of your car. So basically, do not access the PHI that you don't need in your position, and do not discuss PHI with individuals who don't need to know about it, and don't discuss it with anyone who doesn't need to use it. So again, the minimum necessary rule and keeping it safe, and just thinking about those simple disciplines of how you would want your PHI to be treated. So here are some best practices that I thought would be applicable to the way that the PHI within the Juniper and the evidence-based program system could be used, and how we would want to keep it secure. So here are some bullet points. Avoid discussing and using PHI in the unsecured area where we already discussed. And these next few bullet points are securing the information when it's on a computer system. So when you're on your computer, making sure you use strong passwords that are confidential and secure, and that you only have access to that computer, and not letting other individuals access it when you're logged in. Do not leave your computer station unattended without locking it first. And do not engage in risky practices when your computers where you do use PHI could produce some sort of virus or allowing another entity or whatever it is accessing your computer system. So eliminating those risky practices. Using and locking the information on paper once you receive it after a class. Just make sure that it's not in an easily viewable location, either locking it in a document security bag or putting it in a briefcase. And definitely when you're faxing items, use a cover page and ensure that the information that you're faxing with PHI does receive the appropriate individual. So following up with that individual after the fax is sent. And when you're done with PHI, definitely shred it and use appropriate shredding bins, not just recycling bins or garbage bins, but shredding bins. And especially when you do see unusual activity or suspicious activity, report it to your supervisor immediately, or also you can report it to the privacy data officer through Juniper as well. So one thing that we're talking about is preventing breaches of unsecured PHI. So what we want to do is prevent this, but if it does happen, we want to know what could it be and what we do when a breach occurs. So examples of an unsecured breach include stolen or improperly accessed PHI. So if somebody does steal your computer where you access PHI or store PHI, that's defined as a breach. Or if somebody does access your PHI, maybe printed information, printed surveys, or a printed class list, that is a breach as well, potentially a breach as well. And then also if the PHI is sent maybe to a wrong individual, that could be a breach. So this all needs to be communicated to your supervisor and to the data compliance officer at your juniper.org. So again, when you do learn of the potential breach, keep all of the documentation regarding that potential breach and what happened, and contact the Juniper's data privacy officer. And the contact email is datacomplianceofficer@yourjuniper.org. Again, we are obligated as a covered entity, Juniper and IFA, to follow these HIPAA standards and laws. And as well for you all, because you're a business associate under a covered entity, you're obligated to follow them as well. And just keep in mind simple plans of how your information might be accessed. Keep in mind that you want to keep this information safe and secure for the participants of the Juniper program. So again, you can access the policies and procedures from the program developer or by contacting Juniper's privacy officer at datacomplianceofficer@yourjuniper.org. Thank you so much for taking the time to listen to this important information. And again, if you have any questions or concerns, please reach out to us.